Have you ever looked down at your legs at the end of the day and noticed those twisted, bulging veins becoming more visible? Maybe they ache, feel heavy, or seem to get worse every year. What if I told you that one simple evening habit, taking just 5 minutes, could help support healthier circulation and reduce many of the symptoms associated with varicose veins? And here's the surprising part. It's not a medication, an expensive procedure, or a secret treatment hidden behind a doctor's office door. Stay with me because today we're exploring a simple evening ritual that may help your legs feel lighter, healthier, and more comfortable. And most people have never heard about it. Welcome back to Dr. Waterling Hub, where we share practical health information to help you live better every day. Varicose veins affect millions of people across the United States. For some, they're mostly a cosmetic concern. For others, they can cause discomfort, swelling, throbbing, heaviness, and even difficulty standing for long periods. Many people assume that once varicose veins appear, there's nothing they can do except wait until they become severe enough for medical treatment. But that's not entirely true. While no home routine can magically erase advanced varicose veins overnight, certain daily habits can significantly support healthy blood flow, reduce symptoms, and potentially slow progression. And that's exactly what today's video is about. Before we continue, remember that this content is for educational purposes only and is not medical advice. Always speak with your healthcare provider regarding your individual health concerns. Now let's talk about what actually causes varicose veins. Inside your veins are tiny valves that act like one-way doors. Their job is to help blood travel upward from your legs back toward your heart. When these valves become weak or damaged, blood can begin pooling inside the veins. Over time, the pressure builds. The veins stretch, they enlarge, and eventually, those familiar twisted blue or purple veins become visible beneath the skin. This process can be influenced by age, genetics, pregnancy, obesity, prolonged sitting, prolonged standing, and even lack of regular movement. Here's something many people don't realize. Your circulation is constantly working against gravity. Every day, your calf muscles act like a second heart, pumping blood back upward through the legs. But when we spend hours sitting in a chair, watching television, driving, or standing in one position, that natural pumping mechanism becomes less effective. The result? Blood tends to linger in the lower legs. That's why symptoms often feel worse in the evening. Many viewers have probably experienced this firsthand. Your legs feel relatively normal in the morning, but by dinner time they're tired, swollen, heavy, or achy. That leads us to the simple 5-minute evening ritual. The first step is elevation. When you get home in the evening, lie down comfortably on a couch, bed, or floor. Raise your legs above the level of your heart. You can use pillows, cushions, or rest your legs against a wall. Stay in this position for about 2 minutes. This simple action helps gravity work in your favor. Instead of fighting to push blood upward, your veins get assistance from gravity itself. Many people notice a reduction in heaviness and swelling after just a short period of elevation. Think of it like draining water from a garden hose. When pressure decreases, the entire system works more efficiently. After 2 minutes of elevation, move to the second step, ankle pumps. While keeping your legs elevated, slowly point your toes away from you and then pull them back toward your body. Repeat this motion 20 to 30 times. It may seem almost too simple, but these movements activate the calf muscles, which are among the most important circulation muscles in the body. Every contraction helps encourage blood flow back toward the heart. Imagine squeezing a tube of toothpaste from the bottom upward. That's similar to what your calf muscles help do for blood in your veins. The third step takes only about 1 minute. Gentle calf massage. Using your hands, lightly massage upward from your ankles toward your knees. Always move upward. Avoid pressing directly on large visible varicose veins with excessive force. The goal isn't deep tissue massage. The goal is gentle stimulation of circulation and relaxation of tired muscles. Many people find this part especially soothing after a long day. At this point, if you're finding this information helpful, make sure to subscribe to Dr. Waterling Hub for more health updates and practical wellness tips designed to help you stay active and healthy as you age. Now let's continue. The fourth step may surprise you. Hydration. Yes, hydration. Many people focus entirely on the veins themselves while ignoring the importance of blood flow. When the body becomes dehydrated, circulation can become less efficient. Blood volume and flow dynamics can be affected. That's why ending your evening with a glass of water can support overall vascular health. Simple doesn't mean ineffective. In fact, some of the most beneficial habits are often the simplest. Now let's discuss why this ritual works best in the evening. Throughout the day, gravity pulls blood downward. Hours of sitting or standing can increase pressure inside the veins. By evening, your legs have experienced the greatest strain. That's precisely when gentle support can make the biggest difference. Think about maintaining a car. You don't wait until the engine completely fails before giving it attention. You perform regular maintenance. Your veins deserve the same mindset. Small actions repeated consistently often produce better results than dramatic efforts performed occasionally. One common mistake people make is expecting immediate transformation. Let's be realistic. If you've had varicose veins for years, they won't disappear after one evening routine. Anyone promising that is probably exaggerating. However, many people experience improvements in comfort, swelling, heaviness, and overall leg fatigue when they consistently support circulation. Consistency matters far more than intensity. Now let's talk about some habits that may be making varicose veins worse without you realizing it. First, prolonged sitting. Many adults spend 8, 10, or even 12 hours sitting every day. If you sit for extended periods, try standing up every 30 to 60 minutes. Walk around the room, stretch your calves, move your ankles. Those brief movement breaks can support healthy circulation throughout the day. Second, prolonged standing. Standing still for long periods can be just as problematic. Movement is key. Your calf muscles need regular activation. Third, tight clothing around the waist or legs. Excessively restrictive clothing may interfere with healthy blood flow in some individuals. Comfort and circulation should always be considered together. Fourth, carrying excess body weight. Even modest weight loss can reduce pressure on the veins and improve overall vascular health. Now here's something interesting. Many people assume exercise must be intense to help circulation. Actually, some of the best activities for vein health are gentle. Walking is one of the most effective. A simple daily walk activates the calf muscles repeatedly. Swimming is another excellent option because the water supports the body while encouraging movement. Cycling can also be beneficial for many individuals. The goal isn't athletic performance, the goal is consistent circulation. Let's look at a simple example. Imagine two people. One spends most evenings sitting motionless in a recliner for 4 hours. The other spends 5 minutes performing the evening ritual we're discussing and then takes a short walk after dinner. Neither person is training for a marathon. But over months and years, those small differences can have meaningful effects on circulation and comfort. Health often improves through small daily choices rather than dramatic changes. Now you may be wondering about compression socks. Compression garments are commonly recommended because they provide gentle pressure that helps support blood flow in the legs. Many people with varicose veins find them helpful, especially during long periods of standing or travel. If you're considering compression stockings, speak with your healthcare provider to determine what type may be appropriate for your situation. Another question people frequently ask is whether certain foods help. No food can cure varicose veins. However, a heart-healthy diet rich in fruits, vegetables, fiber, and adequate hydration supports overall vascular health. Foods containing antioxidants may help support healthy blood vessels. Fiber is particularly important because chronic straining during bowel movements can increase abdominal pressure, which may affect vein health over time. Again, simple habits often create meaningful benefits. Let's return to the 5-minute evening ritual, because repetition helps create action. Step 1. Elevate your legs for 2 minutes. Step 2. Perform ankle pumps for 1 minute. Step 3. Use a gentle upward calf massage for 1 minute. Step 4. Finish with hydration and make it part of your nightly routine. 5 minutes. That's all. No expensive equipment, no complicated instructions, no extreme effort, just a practical habit that supports circulation at exactly the time of day when your legs may need it most. And here's the key. Do it consistently, not once, not twice, but every evening whenever possible. The body responds remarkably well to healthy routines. Many viewers tell us they spend more time deciding what to watch on television than they spend caring for their circulation. Yet healthy circulation influences comfort, mobility, and quality of life every single day. Your future self will thank you for the small investments you make today. Before we wrap up, it's important to know when medical attention is necessary. If you experience sudden leg swelling, severe pain, skin changes, ulcers, bleeding veins, or symptoms that concern you, seek medical evaluation promptly. Varicose veins can sometimes be associated with more serious vascular conditions that require professional assessment. Never ignore significant or worsening symptoms. Remember, home routines support health, but they do not replace proper medical care. If today's video has helped you understand your veins and circulation a little better, make sure to subscribe to Dr. Waterling Hub and turn on notifications so you never miss future health updates. And here's the thought I want to leave you with. Healthy aging isn't built on one giant decision. It's built on small daily actions repeated over and over again. 5 minutes may not seem like much, but 5 minutes invested in your health every evening can become hours, days, and eventually years of better habits. So tonight, before you go to bed, give your legs 5 minutes of attention. Elevate them, move them, support them. Because the better you care for your circulation today, the better your body can support you tomorrow. Thank you for watching Dr. Waterling Hub. Stay healthy, stay active, and we'll see you in the next video.